Welcome to the latest podcast from the Plastic Surgery Journal Club. Each month we review and appraise a journal article from PRS and summarize it for you in this short podcast. The full paper can be obtained from the PRS Journal website.
Hi, this is Damien Marici and I'm talking with Dr. Jen Law, who is the current unaccredited registrar at the Children's Hospital at Westmead in Sydney. So this paper from the June 2016 Plastic Surgery Journal Club at St Vincent's Hospital in Sydney was the effectiveness of conservative therapy and helmet therapy for positional cranial deformation. This was from way back in March 2015 and it was from out of Chicago in the United States. So Jen, what was this paper about in a nutshell?
So this paper is to assess the effectiveness of conservative therapy versus helmet therapy in infants with positional plagiocephaly and or brachycephaly, and to identify the factors associated with treatment failure for each of these modalities. And so the background to this is basically there's been an increased incidence of positional cranial deformation since the anti-SIDS campaign. And this was a retrospective cohort study of all infants over an 8-year period managed by a single paediatric craniofacial surgeon who had deformational plagiocephaly and or brachycephaly. They identified 5,152 patients, included 4,378, and looked at the two groups, those who received conservative therapy, which included repositional therapy and or physical therapy, and those who received helmet therapy. They measured complete correction using the STAR scanner, and they defined complete correction as a diagonal difference less than 5 millimeters in deformational plagiocephaly and a cranial ratio less than 0.85 in deformational brachycephaly.
So how did the two groups compare? So you've got this conservative group or a repositioning group and then a helmet group.
Overall, complete correction was found in 92.8% of all patients. In the conservative therapy group, complete correction was attained in 77.1%. In the helmet therapy group, this was higher in 95%.
Now, there was a group, however, which transitioned from one group to the other. Do you want to comment on that?
15% in the conservative therapy group were transitioned to helmet therapy. There was no difference in outcome between crossover patients and those who received helmet therapy first line.
Okay, so what's your take-home message then?
The take-home message is that conservative and helmet therapy are both effective for positional cranial deformation, especially when combined. The treatment choice to be considered on a case-by-case basis, and conservative therapy may be more effective when risk factor profiles are minimal, whereas helmets may be more effective in severe cases.
So what were the good things about this paper?
The good things were that this was a paper examining the outcomes in a large cohort of patients with a reasonable follow-up period. There were objective measures of cranial dimensions in all these infants. The bad things were that there was a non-random assignment of patients to the treatment modalities, so this gave a very unequal starting population in terms of baseline characteristics such as age, cranial deformation, as well as in the numbers receiving the different types of treatment. The crossover group also introduced some confounders, and this wasn't really a true comparison as the helmet group also received physiotherapy and repositioning therapy in addition to the helmet therapy.
I think one of the interesting things about this paper is it's a very large group of patients with positional plagiocephaly, and certainly you've got an experience of a group describing the way they've managed these patients, trying to get by without the use of a helmet for the vast majority, but having helmet therapy there for those more severe cases either initially or those who did not seem to be responding to physical therapy and repositioning alone. Because it's not a randomized trial, the answer as to whether helmets are better than physical therapy is not answered, but that was not really the goal of the study. I think they are showing objective measures of treatment outcomes for different modalities of therapy for the same condition, namely positional plagiocephaly. It did show that patients who were not responding to physical therapy and repositioning could still transition to their helmet group and see an improvement in their objective measures of head symmetry and head shape.
Thank you for listening. For more of our podcasts, head to soundcloud.com or subscribe to us on iTunes and search Plastic Surgery Journals. Remember to like us on Facebook and follow us on Twitter. Thanks also to the PRS Journal team for their ongoing support.